Happening now, new concerns about privacy and Obamacare. Critics questioning whether the information submitted to the healthcare website is safe from hackers and fraud. To use the site, you have to enter your date of birth, social security number, and income amount. The website even states that information will be shared with other government agencies. I'm going to guess emails, all sorts of different ways. John Roberts is live in Atlanta. So, John, how do we allay our fears?
Good morning to you, Harris. You know, there are some cybersecurity experts who believe this is another step down the rabbit hole into big data. If you look at the privacy policy on the website, which many people don't, it states quite clearly that your data will be shared with the Internal Revenue Service, the Social Security Administration, and the Department of Homeland Security. Now, all of this, of course, is under the premise of income verification and immigration status, but it does put a government database squarely at the center of your health care decisions. And as we've learned, source code in the website's terms and conditions states that users have no reasonable expectation of privacy. David Kennedy is the president of Trusted Sec.
This is just another validation point that, if the government has that information, they're going to use it for other purposes, not just for the actual medical field or for, your healthcare benefits.
Now, one other item to pay attention to on the website, the government has contracted a couple of third parties, including Experian, to verify your identity when you sign up on the website. Experian recently acknowledged that one of its subsidiaries was duped into selling valid Social Security numbers to a hacker in Vietnam, Harris.
There's this little hearing going on Capitol Hill right now about Obamacare. How about you and I crash it and ask them about this issue? I do know, though, that they've made some changes to the site.
They have made some changes to the website. This week, you got the ability to be able to browse for various healthcare plans and get very rough cost estimates without putting in any personal information, personally identifiable information, PII as it's called. But when you call the Obamacare phone hotline, it's a different story. When I called in, here's what they told me, followed by a comment for the Centers for Technology and Democracy.
I need your name, your date of birth, your mailing address, the amount on your W-2 form, your Social Security number, and a couple phone numbers.
To ask an applicant for a Social Security number and sensitive information until they're absolutely ready to apply for a particular plan should not happen.
So the website doesn't ask you for the private information, but the healthcare hotline does. A recent AP News University of Chicago poll found 58% of Americans don't think the government is doing a good job at protecting their right to privacy. So, Harris, this feeds into all of those anxieties that people have.
You know, John, a little while ago, Frank Malone of New Jersey was saying, well, utilize the other ways other than the website to get your health care in place, like a phone call. But then they're writing them down on little pieces of paper. Who's collecting the pieces of paper?
Well, it's interesting. The agents are collecting the pieces of paper, but they are also inputting that data into the very same website that you would use if you did it on your computer. So it's all going into the same place one way or another.
John Roberts, thank you very much.